Hi, good evening, everyone. Welcome to the Pink Life, and we have a special guest tonight, Dr. Matt Hedelius. And for full transparency, this is also my brother-in-law. He married my sister Becky, and they've been married 35 years with 9 children. So, hands off to that. I'll give you a little background on Dr. Hedelius. He is an experienced psychotherapist with 29 years of practice. Like he's had a practice and has been working on many people. Of course, we needed a therapist in our family, duh. And then he also holds a master's degree in clinical social work and a doctorate of psychology degree. I hope I said that right. Focused on advanced clinical training, he specializes in diagnosing and treating trauma and problematic sexual behaviors. So beware, this might be just for adults only. I don't know. And then, having worked in various hospital settings while conducting evaluations for the Department of Psychiatry in critical care areas and treating patients in the behavioral health unit. Additionally, he directs his outpatient clinical practice and is the director of Paradise Creek Recovery Center, where he provides specialized 6-week treatment programs for individuals with problematic sexual behaviors from across the United States and internationally. Hello, Matt.
Hi, Pam. How are you?
Awesome. Thanks for wearing pink, representing Pink Life. I wore brown, but he's in the spirit of it, so I appreciate that. Um, let's just start off. We're going to cover trauma today, everyone, um, and I think this is a really important subject because there's been a lot of people, and also we'll sum it up at the end, but I want to know also how we can get our children to talk to us about anything that happens, in their lives. But anyways, so what is trauma, Matt? Let's define it.
Let me maybe back up just a little bit and talk
Okay.
about how I even got to
Okay.
this point in terms of trauma. All my research in graduate school was on the impact of sexual abuse in females. And I really thought that most of my work would be working with victims of sexual abuse. And as I got studying for my research, I realized and learned that the women who had been sexually abused as children, when they grew up and had daughters, their daughters were more than twice as likely to be sexually abused by someone outside the family than the normal population. And there's a few things that a few variables that went into affect that. The first,
That confuses me, and I'll tell you why, Matt. I'm about to say Dr. Who it is, but because because it happened to me when I was young, I was molested. But I was paranoid. I wouldn't even let my kids spend the night somewhere. I made everybody spend the night at my house, and I separated. So I'm curious why you think that, why not you, but why did the study show that a mom that has been sexually abused has more, her daughters have more of a chance of that? How is that possible when I feel like I'm triple overprotective, comparatively speaking?
yeah. So good question, and I'll answer that here. So there were three variables that we studied. First of all, the women who had been sexually abused on a self-esteem rating scale, by and large, their self-esteem was less than half of women in the general population. Their sense of assertiveness was significantly decreased, and their perceived ability to solve problems were also decreased. So those three variables influence that outcome. So basically, a daughter grows up and models mother as lower self-esteem in general, not every case, but in general, that vulnerability increases her likelihood of being abused, coupled with her lack of assertiveness and perceived problem solving. But another piece that we can get into here is that research shows that many individuals who were sexually abused as children and grow up and have parents, they're more at risk themselves for dissociation. And psychological dissociation is basically a checking out from the present. So it's one of those experiences that you have when you're driving down the road on the freeway and you realize, oh, I've gone 20 miles and I don't remember it at all. Your mind kind of checked out and went into autopilot. And we know from research that what happens is it's the right prefrontal part of the brain that starts to shut down. And so you're not recording as much and you're not being aware as much. And so that factor alone, then if a mother is dissociated, then they're not necessarily aware of some of the high risk scenarios or situations that a child and particularly a daughter may be getting into. Now, not everybody responds to trauma that way, and we'll talk about that in a minute. In your case, you may have been much more self-conscious, much more hypervigilant, and focused on protecting children.
Yeah, I went a
In
little
your
bit overboard, but I didn't know any other way. But
Yeah.
I do find myself checking out. That's interesting that you said that. At family things or whatever, sometimes you just have to be shut everything down. But
Mhm.
anyways, go on. Let's define trauma.
So trauma is basically experiencing a physical or psychological, which can also be environmental event that impacts the nervous system so severely that it alters it in a negative way. So, for example, it used to be believed and thought that when one experienced trauma, they had a bad memory. So we have a traumatic event, and then we keep remembering the event, and because we can't forget it, that's trauma. Well, that's a very small piece. We know that trauma impacts the entire nervous system. So when somebody is traumatized, it's the body and the nervous system that remembers it, not just the mind. A great psychiatrist, Dr. Basil Van Kolk, he wrote a book entitled "The Body Keeps a Score," and the premise of that book is just how the body, the nervous system, down to the cellular level, keeps the score of trauma. So, for example, let's say that you were in a difficult relationship, a difficult marriage, and it was there was abuse and anger and threat. Let's say you get through the divorce and you're 5 years out of it, but then a situation arises where you have to have interface with this individual, or maybe you even take a trip down memory lane and say, I'm just going to drive by the house and just look at where we used to live. When you do that, you remember it here, but then you start to remember it here. You have an increased heart rate. You remember it in your stomach and your gut, and you feel those feelings. And pretty soon it's the entire nervous system starting to respond and to react in a very similar way that it did in the original trauma. And so the biggest way that we have to look at trauma today is that it's not just a memory, it's a whole neurobiological experience that affects the entire nervous system.
I actually believe that because when I drive by Daytona, that was my first husband, various business things there, and I get anxious.
Yeah, and this can be a very debilitating situation, especially when uh, most people who are traumatized don't get adequate treatment or they're undertreated. So let's go back, for example, to where we started and talk about sexual victimization of young girls. Let's say that they are sexually abused, and so they maybe mom and dad find out about it, maybe they don't, and incidentally, most sexually abused individuals go undetected. So most sexual abuse that happens, it's not brought to awareness of teachers, of parents, or caregivers. But so let's say it's suppressed, the individual starts to dissociate, which is that disconnecting from reality. And let's say they get into a relationship, maybe they're dating, maybe they're in a marriage relationship where they start to begin sexual activity. Well, the body, having kept the score, then starts to react, and it either shuts down or it can start to experience what we call a reaction, which is a reliving of the original abuse. So you may be in the act of a sexual experience with a loving, committed partner, and you're seeing the face of a perpetrator, or your body is remembering that first perpetration. And when a person is traumatized, there's four different responses that can take place in the nervous system. So the first is fight. So in the wake of the threat, if someone's coming at me, the big bear is coming at me, I can fight. But if my mind recognizes, you know what, I'm no match for this bear, and so my fighting is not my best chance of survival, maybe I can run. So fight or flee. Maybe I can run. But then I realize, I may get a few feet, but he's going to catch me. So then the third scenario is freeze. So or play dead. So that and this is all unconscious. So the nervous system does this unconsciously. So maybe I play dead, but the fourth response is appease. So let's take this to a real life scenario. So let's say I'm in a abusive relationship. I know I can't fight him. I don't have a car. I don't have the money to get away very far. He'll find me. A lot of times I just freeze during sex, during daily activities. I just freeze and check out, and I'm physically there, but mentally my mind's somewhere else. But the fourth response is appease, where we try and please him in such a way that we gain his or her approval in the hopes that we're going to be the recipient of less anger, less violence, less abuse. And all of these take place on an unconscious level. So the nervous system is superb at being able to know what we need to survive. But when we don't realize what's going on, then sometimes maybe we get out of the relationship and we say, okay, why did I stay there for 30 years or 20 years? Why did I give him or her breakfast every day and give him sex every night and all these things like I liked him or loved him, when in reality I was being very, very traumatized. And sometimes as loved ones and family members, we may look at those situations and say the same thing. Well, why didn't you just leave? I mean, we were right here. Why didn't you call us? But it's just not that easy. And so we have to realize that however our nervous system responds to trauma, it's going to give us the best chance of survival, but it's much, much more complicated than just saying, I'm just going to walk away from this situation.
So we should be when we're telling people who are going through things, it's not just an easy, well, I don't know why they stay in that relationship, or we've told them to leave 1,000 times. They have to really they need just support, really, I guess. And just like maybe comfort just in saying, hey, when you're ready to leave, let me know how I can help. Or what would you say we would do? What should we do? Because
So,
I have said I have said before that I don't understand why this person's still there, and I've talked to him till I'm blue in the face. So I have nothing to say anymore about it. Well, maybe that's not the attitude to have. What would you suggest?
let's even add a different scenario. For example, sexual assault is one of the most difficult crimes to prosecute and to win. And most district attorneys, they don't want to touch it unless there's a real chance of winning. And
Why?
the so this is the reason, because during sexual assaults, people dissociate and they freeze or appease. Now, someone who has a limited understanding thinks, well, why didn't you just kick him in the testicles and pull his hair and bite him? Well, that would be fighting, but the nervous system knows I'm 110 pounds, he's 200, he's no match for me. Uh, I can't get up and run, and so I freeze. And he then thinks, well, she didn't say no, or maybe she even appeased me, and so she wanted it, but it was much much different than that in reality. So research shows that one of the main things that a trauma survivor needs is they need to be seen. They need to be heard. So if I have a family member or a loved one coming to me and talking about their sexual assault or their trauma, yeah, I may be full of advice and can give this and this and this and this, but the first overwhelmingly thing that they need to get stabilized and to gain a sense of safety is they need to be seen and heard. So I'm going to give our listeners what we call the four S's of secure attachment today, and going a little bit off script here, but I think this really applies to helping someone recover from trauma. If we bring in another word closely related to trauma, that is the word attachment. And attachment refers to the connection that we have with another individual, which is also neurobiological. You know, when we love somebody, we don't just love them here. We really connect and we experience co-regulation. So when they come home, feel safe, feel secure, and all is well if it's a good attachment. So there's four S's. First thing that we need to connect with somebody, we need to be seen, truly seen for who and what we are. There needs to be a sense of safety. So I need to be able to talk about the trauma that I have experienced and know that it's going to be safe. And I'm not going to get, well, yes, but, well, this, but, well, why did you do that? And it's just safe. There needs to be a sense of security. And the security refers to predictability in that I know by and large what the response is when I'm going to go and talk to mom. So most of us, at different times in our life, when we have trouble, we'll call mom. Mom, what do you think? And we call mom just to talk. It calms our nervous system because we have that predictability over time that we know that mom's going to listen. The fourth S is the ability to be soothed. So the person helping the trauma survivor has the ability to soothe that person. And it could be simple things as such as a hug. Maybe we're going for a walk. Maybe I'm just patting on the head. Maybe we're making a batch of cookies, but it's a soothing experience. So seeing, safety, security, and soothe. Those are the four largest things that as family members, friends, and loved ones that we can give a trauma survivor to help personally.
So if they're telling us the story that we've already heard, it's still okay just to listen. We're not enabling anything. We just listen and offer safety and security and any soothing that we can. Is that what you're saying? No matter how many times they've told us.
Yeah, and in time, their own nervous system will start to understand. Okay, I've been heard and I've been seen, so there's not that need to keep telling this story. But you have to realize that if they're dissociated, they can come and talk to you and tell you the story, and they may not really even remember that they've told the whole story. They know they've talked, but they don't feel like it's really been communicated the way they need it to be. Um, Now, there's probably a time when it would be okay to say, Jim, um, we've you've shared this with me in trust 7 or 8 times now, and I am honored that you would do that. Why do you think maybe that you think you need to keep telling the same story? Is there something different that you would want from me? Are you feeling that I'm not hearing you? Because I'm here for you, but I want to make sure that I'm here for you the way that you need me to. And something like that may help bring their trauma from here up to here, so they're thinking about it more cognitively, and they can actually realize, oh yeah, I have told that to Pam 5 or 6 times, and she has been there for me, and that's why I keep going back. Maybe I'm getting a little bit better here. So there are room for those questions, certainly.
Interesting because, like when I first came out of prison, I must have had to talk about that for the first few years. And I remember talking to Terry Sargent, and it's like we're one of us couples, and I'm just like, and then I feel bad afterwards. But I had to like tell that story 1,000 times.
Yeah. Research shows that we need a witness. So if
We
if
need
we've
a
been
witness.
traumatized, we in order to get well, we need a witness. And so that's why group therapy is so effective, because you're in a group of individuals you can connect with. and you
I'm
have
taking
those
notes, by the
witnesses.
way.
You have those witnesses to your trauma, non-judgmental. That's why, in part, therapy is effective. And in fact, let me talk about that a little bit. There's one part of the brain that we know, or two parts of the brain, sorry, that will and can be impacted by trauma. The first is what we call the amygdala. The amygdala is the center of the fight or flight and the fear center, and it is fully developed at birth. So it's not a very big piece uh, of their brain, but it's fully developed at birth, and that's why a baby at birth can be frightened or scared. If you come in and yell or loud noise, uh, they're going to respond because the amygdala helps detect threat and danger. Another part of the brain, however, is the hippocampus, and the hippocampus helps us um, understand what we've experienced. So it helps us process memory and make sense of that. So let's say that we experience what we call a little t trauma. So things are going pretty smooth for us, but we go in after school one day and we see mom and dad fighting and yelling, and it scares us. That's a little t trauma, but our hippocampus is in good shape so that we can process, that was not fun, but um, I've got all these years of mom and dad working together and vacationing and loving one another and seeing hug and kiss. So things are probably okay. I'm going to use that as my primary frame of reference. But when someone experiences significant long-term trauma, the hippocampus actually shrinks in size so that then when we have these traumatic experiences, we get older, we don't have a different frame of reference. We're not able to think about it rationally and say, okay, that was a unique event, or I'm safer now, I'm out of the house, I'm at college, the perpetrator's dead, whatever. We're not able to think about that in such a way because the hippocampus has shrunk and the amygdala has increased in size. And so we're hyper vigilant, we're jumping, we have an increased startle response. So I share that with you because there's two factors that can change that. And the irony is there's no medicine, there's no surgery that can reverse those effects. What we know from research is that one, being in a relationship with another person who has a healthy brain and a healthy nervous system can start to shrink the size of that amygdala and bring back the full size of the hippocampus.
So a relationship can help, a good relationship. Okay.
Relationships help. And the second thing is long-term psychotherapy with an effective therapist. And so certainly I'm a proponent and supportive of that. But what we're talking about today is just if we are that witness and we can be there for somebody, we can set boundaries. But if we can be there for somebody, we can help to literally repair their brain and repair their nervous system. And that is something that no medicine, no surgery, nothing like that can do.
That's very interesting. When I first got out of prison, I always made sure I had $3,000 in my wallet, cash, so that I could flee at any moment. Isn't that weird? Just things like that. I don't have to do that anymore, but I did that for 15 years.
Well, it's not weird if we know where you came from. And we know those close to you and your friends, and you especially know where you came from. And so it made perfect sense. And that was part of giving that security that at least I'll be able to get a hotel, at least I'll be able to do something
Yes.
for a few weeks.
Yeah, $3,000, you're not going to get very far, but I had to know that I could have a 72-hour, window to figure things out.
Yeah.
So I just thought that was interesting that you said that. And also that we need a witness. I'm trying to understand because I completely believe it because of how I've had to tell my story so many times. My poor friends have probably worn them out, but I'm wondering why the need for a witness is so important.
So it all comes back to connection. So uh, go back to attachment. Attachment, that is that connection, and attachment is a neurobiological experience. So when you have a baby and you hold that baby, it's a completely neurobiological experience. And connection takes place on the right side of the brain. So, an interesting bit of research here, mothers, regardless of whether they are left or right-handed, most mothers that nurse will hold their baby on the left breast and the left side of their body. So think about that.
That's
It's,
true.
it's the right brain that has to bond and connect. So if I'm talking to the baby is hearing it out of the left ear because the right ear is covered up by the breast, as is the right eye. And the left ear and left eye are connected to the right brain. And so I'm talking to the baby, she's talking to me, and we're sending these messages back and forth. And that is that security. So when I'm in a traumatic situation, I'm also in the right part of my brain. When I'm telling the story about how I feel, now, if I'm going to a police officer and just talk about the events, well, at 6 o'clock, we went on a date, we went to the bar and did this. That's all a left brain narrative, a left brain experience. But when I start to talk about it with a friend, it's the right brain that starts to be activated. And there are actual signals that go from your right brain to my right brain. And my right brain then says, ah, I've got a witness. Pam understands. Pam gets this. Uh, she's hearing me, and that's why they keep coming back.
Interesting. I'm not sure why I would always feel guilty after I talked about it, but I mean, I would always feel, I would like have this really urge to have to say something and tell the story. And then right after, as soon as I was done telling the story, I felt embarrassed.
And probably some of that is when you initially have the desire to tell the story, you were probably somewhat dissociated in that initial state. But as you start to talk, then you become more present and you wake up here and realize, oh boy, that was a lot to dump on them the last 45
Yeah.
minutes. And they didn't get a word in edgewise. So you're becoming more socially aware. But it's just part of the process. It's
Okay.
it's just part of it.
It just kind
And
of made me human, I guess.
yeah, it's just part of the
So
process. And
how does, so trauma specifically, how does what can it do to an individual and how can it affect their life?
so we touched on that somewhat here today, but neurobiologically, it's going to do those two things: increase the amygdala, decrease the hippocampus.
Okay.
So we're just not going to be able to process our memories and make sense of them where we can put them in their proper place. Another thing it does is it activates what's called the HPA axis in the nervous system. So the HPA axis refers to the hypothalamus, pituitary gland, and adrenal gland. And that's basically a triangle of different parts of the nervous system that, when activated, it mobilizes our bodies for threat. And so if I'm running around and that's being activated all day long, and my body is full of cortisol and adrenaline and noradrenaline or norepinephrine, then I think um, life is dangerous. So I'm walking around with an AK-47, just waiting for someone to come in the room. Now I don't have the gun, but I'm just waiting for that person to come in, and I'll snap at them or I'll overreact because I'm in fight or flight. Or let's say we have gotten stuck into this appease response. So we have to please someone. So my trauma was with dad, and I wasn't accepted by him and loved by him. So then I get older and I get into a job and I have a boss that's kind of nice. So I turn the boss into my dad, and I want to please him, and I'm gonna just when he leaves, I'm gonna make sure his desk's all nice and wipe it off and have his coffee there for him in the morning. And initially, he starts to think, this is great. Well, this is the best employee I've ever had. But he starts to feel it after a while, he'll turn around and you're right there because you're there to give him something. Oh, look at this paper I just wrote or did, and those relationships tend not to last very long because um, he'll set a boundary, and then you feel rejected, and you've successfully then repeated or reenacted what you went through with your dad, and so you keep going through this over and over and over again. So, uh, therapy with an effective psychotherapist can help you recognize those patterns and say, okay, we're going to treat this boss as a human being. I owe him 8 hours of work for 8 hours of pay, uh, but but I don't need to reenact this trauma that I had with my dad.
Do you feel like people ever use trauma as an excuse for bad behavior?
Uh,
I know that's a
I
sticky question, but I'm curious.
I think it can be, and I think that there are many defense attorneys that will certainly suggest that. But let me share an experience I had 30 years ago when I was in the middle of my clinical training. I was in a clinic that treated primarily offenders of sexual abuse. And I got involved in this group, and as is traditional, anytime you have a new member of the group, each member of the group shares their story in about 3 or 4 minutes. So I was a new member of the group, even though I was a clinical personnel. So all of these individuals who had been to prison, jail, done some pretty heavy things, told me their story. And when I was done with that, I was just taken back, and I I was overwhelmed by the amount of trauma that these individuals had. And at that point in time, I had the thought that if there's ever a population, if there's ever a group of individuals that need the absolute best treatment available, it's this group right here, the individuals like this, because this is where it's going to get stopped. Because if it doesn't stop here, it'll just keep being perpetuated. So I tell people we want to understand your past, understand your trauma, and understanding it will help us stop what you're doing. We can never use it as an excuse, but we won't stop it unless we heal your own experience and understand it. So it's a fine line there,
Right.
uh, and I think an effective practitioner can communicate that the both are important. We need to understand the history, but you've got to be held accountable, and this is how we're going to help you do that.
What made me think of the question was just because sometimes I have that conversation with myself. I'm just like going, I can't be I can't be remembering this or feeling bad about this. Even though Dr. Free, what's your partner's name again?
Freestone.
Doctor, yeah, Freeze. He told me, he says sexual abuse always is on a woman's top shelf. That's what I remember him telling me. That kind of stays there, and we just have to learn how to deal with it. But or live, get past it. But and then I just was wondering, sometimes I thought I'd use it as an excuse for being angry or for, and sometimes I feel like I'm telling myself, get over it. You're not that special because so many girls are molested. You know what I mean? Like it's like a common thing. So,
And the horrific research, and it's been constant since I began my studies back in the early 90s. One out of every three females will have some type of sexual assault by the time they turn 18. That's just by the time they turn 18. That doesn't include what's going to happen after they go to college and other things like that. So it's really closer to 1 out of 2. And depending on the
wow.
study, one
I'm
out
not
of
even
4 is 1 out of.
shocked. I'm not even shocked at that number because in my family, it's been experienced a lot, not within our immediate family, but like outside family members that had come in and I just I've been told that a lot of times it's done by family somebody who's related to them.
most sexual abuse in childhood and adolescence will be experienced by someone inside the family or close family friend. Uh, but most of it's intrafamiliar and of
How do you
course
know when to trust somebody?
that's that's a good question. Uh, I firmly believe, and that could be a whole other series of podcasts, but I firmly believe we have to get to the point where we trust our nervous system. And and your nervous system really is not going to betray you. So even in those situations when there's a freeze or a appease, freezing at that point in time is probably the most effective thing you can do to maintain being alive. Because if you keep yelling or screaming, he's going to be afraid that you're going to go tell somebody and he may kill you. So if you freeze, that's your best chance of staying alive. And so we can trust our nervous system. So how do we know we can trust people? We're going to feel something. We're going to feel something, and our amygdala, if we tune in to what it how it communicates to us, we can realize, oh, my heart rate just increased, my breathing just changed. That's trying to tell me something. Uh, at this point in time, and parents today, I would never ever recommend the the process of sleepovers ever again. That I think sleepovers really have to be a thing of the past. 60s, 70s, 80s, we did those things. But I think you could probably ask a child today, sleepover, what's that? Because you just don't know. And there's so many men that I treat inpatient who have experienced trauma and are severe sex addicts. Their first exposure to really explicit sexual material or trauma was at a friend's house or an uncle's or someone else's. So I think, different topic, but keep the kids home, have a late night
Right.
activity that.
Right. I wouldn't let my kids spend the night, and then I will say that because I just couldn't risk it, but I let everybody spend the night at my house. And when they and in the very beginning, I sometimes would go to sleep, but then about around I call it the Michael Hardy era, but because I found out some things that were happening, I had a rule that I want me or Matt, somebody had to stay awake all night. And we didn't budge on that. You know what I mean? Because I just didn't trust. Now, I have to say that, I'm not saying that using it as an excuse, but I feel like I can not be hard on myself, but I feel like I can tell myself, so many women that go through this. Why should I let this be bothering me? It happens to everybody, practically. You know what I mean?
Yeah, and I think that's a common thought process that many victims have, well, both men and women, because it is very common, way too common when it's too many. But
I mean, those
uh,
odds are so bad. Can you imagine if you had odds like that when you're jumping out of a plane? We would never
oh
parachute dive. We would never go skydiving. You know what I mean?
no, or cancer or diabetes,
Right.
there would be something significantly different if I knew that I had a 1 in 3 or 1 in 2 chance of getting a brain tumor by the time I'm at 18 if I drove a car. I wouldn't be driving a car, So,
Right.
so, uh, but
I think that's how parents need to look at these sleepovers and things. Just say, it's just not worth the risk. It's not because we think everybody's bad in the world. That's not it. It's just that if you're having a 1 in 2 chance or 1 in 3 chance, I can't justify that because I would not put my kid on a skydiving plane if it was 1 in 3 chance. So I just rather not risk it.
yeah, and so, but we have to be careful when you ask the question, why should I get so upset because this is so common? Well, this this is why you should get upset. And as we go back to the nervous system, uh, sexuality is at the core of our nervous system, meaning we can't get any more vulnerable than we are when we're in a sexual situation.
True. Yeah.
Uh, so, and the irony of it is that vulnerability has to be there in human sexuality in order to gain connection. So let's say we have two people that have been together for several years or several months, and they for just for the purpose of this show, they have not been sexual, and they decided, okay, we're going to get married, and so they come together on their wedding night, and the thoughts are, gee, is she going to think I'm too big or too small, or is she going to like what I look like, and vice versa? So we're walking into this thing very vulnerable, and the fact that we can literally expose ourselves to another person and then experience acceptance, that's what creates connection, and that's what creates the bond. So uh, that is fairly innate, it's unconscious, and is at the center of our nervous system. So if we have someone violate that at another age or an earlier age or another situation that requires no vulnerability like that, it's just forced upon us, that's going to change, uh, likely going to change our entire nervous system and our narrative. And our narrative is this talk that we take with us uh, throughout our lives. And so, yeah, we have to be careful about dismissing our own trauma. Now, uh, we may have some assets that help us uh, engage in resiliency and overcoming, and we all have some of those, and so that's great. But let's go after them. Let's use them. But we ought to be very, very cautious about dismissing our trauma and we ought to have a high level of self compassion when it comes to these type of things.
I'm gonna write that down. We should be dismissive because I think I do that. Anyways, so how does trauma show up in our relationships with our children, our spouses, our friends?
So, so trauma can show up, for example, of us with children being overprotected,
Right.
smothering, enmeshed, which can be traumatic in and of itself.
Yes,
Or
I did that. I did that horribly. I was horrible. I did, but especially with my daughter Katie, I just wanted everything to be perfect for her.
or we can go to the flip side, and because we're dissociated, we're overstimulated, overwhelmed. We just it's too much, and so we don't set any boundaries. And yes, fine, go ahead. Yeah, be home by 3. Yeah, I know you're 15, but just be home by 3 o'clock. Make sure you shut the door on the way in. We can do that way, and and those that's one way it can show up. Um, we can be completely untrusting. Oftentimes, our nervous system knows what it needs to soothe, so we can eat our pain away. We're going to eat it away. We're going to eat at 10, then at 12, then at 1 o'clock in the morning, go to bed for a little bit, and then just get up for a little nightcap about 4:30, 3:30, and soothe that pain and eat it away.
Would you say that most women who've had trauma in their life do have an eating problem or heavier?
So it'll either go to overeating or undereating. So we can become um, what we call acting out or acting in. We can act out with food or act in with food by restricting. Both gives us a sense of control and a sense of safety. It's pseudo safety, fake safety.
I'm not now. I'm just now. I've recently in the last month and a half. I've been watching this show, 600 Pound Life. I've never been able to watch it before because when I was heavier, I mean, it was too close to that as a possibility, so it scared me to watch it. I would never watch it. But now I was watching it because I'm kind of going to another part of my life where I want to uh, do experiences with. I have two doctors that I'm actually trying to work with that, talk about cosmetic surgeries and bariatric surgeries because I feel like I've had success in those areas. And I just want people to know what worked. Well, everybody in that 600 pound life, I don't know of one, not one, that hasn't had a sexual problem in the past. like something that happened to them.
Oh yeah, those people are not there just because they have an ultra excessive relationship with food. It's all about trauma,
Right.
and if we could get into their
I mean,
heads,
every single one of them.
yeah.
So that makes
And
sense.
let me add another piece here that's important. There's a concept called or known as eroticized rage. Eroticized rage. And eroticized rage occurs when eroticism, so sexual eroticism, gets fused with anger. So, for example, many sex workers, dancers in strip clubs, escorts, that type of thing, they experience eroticized rage, and it stems from them being sexually abused and taken advantage of as a child or an adolescent. There may have been some body betrayal. So, for example,
Was a body
sexually
betrayal.
abused. So, sexually abused went repeatedly, and they know it's wrong. This man is abusing me, but my body betrays me, and I have an orgasm or I have some type of sexual stimulation, and it's very, very confusing. So we call it body betrayal. The reason that
I've
happens
never
is
heard the
because
word body betrayal, Matt, but I want you to know something. I said in another podcast, which is very true, that one of the things that made me feel really bad about being molested was because I couldn't decide if I was enjoying it or if I was hating it. I did freeze and then I was scared, but then afterwards I'm like, did I like that? But when you're 5 and 8 years old, my body was just reacting to something, but that shouldn't have happened to me. But I've
yeah.
never heard the word body betrayal, which is very interesting to hear that
So
word.
if there's one message to get across tonight, it's this: that sexuality and sexual functioning is a midbrain and lower brain experience. So what that means is that it's unconscious, and the midbrain and the lower brain does not think. It cannot think. It can experience and process, but it doesn't think. The upper brain, the prefrontal cortex, and other areas, that's the part of the brain that can think and say, oh, this is wrong or right or whatnot. But if someone's abusing me, there's this tug of war going on, and my body will often respond. And then, and that puts me in a fight or flight here, coupled with orgasm. The perpetrator goes away. I kind of come back to presence, and I think I may have just liked that. I I may have been the reason. And then what does the perpetrator do? He sends us messages. He gaslights us. Well, I know you liked it because I could tell by the way you were sounding. Now, that is not a good data set to be able to make that type of judgment. But that's how they will use their narrative. So back to eroticized rage. Eroticized rage then comes in where a woman has been abused, they had body betrayal, they are now angry at men, and so they become a sex worker and have sex 10, 20, 30 times a day,
Do they
and
really have
they're
sex that often?
uh, some do unfortunately,
Well, I
sad stories another day, but if you wanted an interesting read and study, uh, go talk to 7-Eleven and convenience store clerks at about 2 and 3 o'clock in the morning, downtown Chicago, LA. Women coming off the streets will buy a bag of ice, put on their genitals just to bring the swelling down because they've been working so hard that night. So that really happens. But they're they're in the business not because they like sex, but this is how they're acting out their anger towards men. They think these poor piddly men, I can get you to come in here and you think I love you or care about you. I say all these things, but I hate you. In fact, I hate you so much, I'm going to get $500 from you when you come in this room tonight. Or a dancer and getting men to shove $100 bills in their panties, and they're smiling, and these men are thinking, "Oh, she likes me," and she may be saying it, but the woman is saying, "What a poor disgrace of a man." So that's how eroticized rage can show up. It can also show up in terms of what we call love addiction by a woman uh, getting addicted to the experience of falling in love, all those fun chemicals that, again, is a different show, a different topic, but they get addicted to that. But then they don't have any emotional uh, bandwidth to really engage in a long-term relationship. So once they get there, then they pull out. There's this love chemical, phenylethylamine and oxytocin, that they just fall in love with. Those are the chemicals that make us feel so good when we fall in love. That's They can become addicted to that. So those are some of the ways it can show up in relationships. And I know that we talked about maybe more global broad trauma. We've kind of gravitated to the sexual trauma, which is okay, but that's why I wanted to share this experience.
I'm wondering if sexual trauma makes, because sometimes I feel like in my, I know I've been married 3 times. I'm no example of marriage, but I feel like I've had to, especially my second and third husband, I felt like I had to, I would put him to a test to see if I really could trust him.
Yeah, and that's part of that reenactment. So this is another good word to write down: a reenactment, where we reenact some of these earlier traumatic experiences. And so I'm gonna be crazy to see if he'll leave me.
Yes,
Will will
that's it.
will you really leave me? So I'm gonna come home and I'm gonna be, for example, sexual and kiss, kiss, hug, hug. And then he pursues me and says, "Oh, I'm tired. I'm going to bed." Or, "Why do you always want sex?" Or, why are you doing this? And he's thinking, "Well, wait a minute." And I just thought you sent me a clear cue here. But it's the nervous system trying to test the waters. Is it really safe in this relationship? Is it safe? And some individuals, men and women, will unconsciously create chaos just to see if their children will love them, if their spouse will love them, their partner, if their boss will uh, be dedicated to
Can
them as an
children create
employee.
chaos to make sure their parents love them?
Uh, it can go both ways, depending on uh, depending on the path that they got there. So, for example, with children, it's mostly children who have experienced early developmental trauma, uh, and maybe they were adopted at 1 year or 3 years of age, a lot of trauma. They're going to be very happy to get a parent, but then they're going to say, "Okay, do you trust me? Or are you really going to be here for the long haul?" And so they'll um, dad has a prized set of golf clubs, and they'll go break them, or something like that, and just to see. And again, it's unconscious. They're not really that smart to be able to walk through this like an adult would, but they're testing the waters.
That's interesting. I think I've seen that a few times actually. Wow. Okay, so well, do you want to go through the few different types of trauma, or did we already cover that?
So yeah, we could get that here towards the end. So a few different types of trauma that we've covered. There's acute trauma, and those are very significant traumatic events that just blow us out of the water and have a long-term effect. So, for example, seeing a murder or something like that.
A rape or something
There's
like
chronic trauma that are lower traumatic events that tend to build up over time. And when we have one on top of another, that's called complex trauma. So the best way to
I
remember
don't know
all
the
this
difference
is
between I don't have an example of complex because you said chronic trauma was more like having an alcoholic parent or something that happens recurring. But what's complex trauma? I don't know what that is.
so complex trauma is very much like chronic trauma, but you have um, divorce of your parents, which is a big trauma. So you go up, and then you're starting to stabilize, and then you have a sexual assault, and you go up, start to stabilize, and then you have another assault, and then you get arrested and go to jail. So you haven't fully your nervous system hasn't fully recovered before you have another
Oh,
traumatic event.
okay.
So the best way to remember these is big T traumas and little T traumas. Um, Not everyone will have a big T trauma in their life. A lot of people will, but not everybody. Most of us will have little T traumas. And the little T traumas are getting fired, losing a job, it, maybe getting divorced. That could be a big T as well. But we're going to have traumatic events, and so we need to keep those in perspective. And certainly the healing aspect of this is we have to gain a sense of resilience, and and maybe we could end on this section here. Uh, there's a concept that we know is referred to as polyvagal tone. Polyvagal tone.
Okay. Vagal is not like in the vagus nerve, or is that
Yeah, yeah,
okay?
yeah, yeah. Polyvagal tone, and polyvagal tone refers to our heart rate variability. So what that is, our heart rate, we may be have an average heart, we may have a 60 beats per minute heart rate, but that doesn't mean that each of our heartbeats are exactly 1 second apart. So our heart speeds up and slows down, speeds up, slows down, and so maybe one between two beats is 1.2 seconds, and then half a second, and it varies. But our breathing is what controls our heart rate. So every time we breathe in, heart rate speeds up. Every time we exhale, heart rate slows down. And we need a healthy polyvagal tone of where we're getting a good differential between the lowest point and the highest point of our HRV or our heart rate variability. So trauma people, they will either have a very high, jagged polyvagal tone, so their heart rate is speeding up, slowing down, speeding up, slowing down, and that's telling them there's an emergency. Now it's calm, emergency, calm, or it's flat. But if you can get a polyvagal tone that just has nice bell-shaped curves like that, that person is well on their way of having a resilient healing. And what we have to recognize and Dr. Stephen Porges talks a lot about this, is that every time we exhale, our nervous system has a chance to recover and to stabilize. So if we're anxious, we tend to want to breathe in fast and catch our breath. But the best thing to do is
Right.
exhale. That slows the nervous system down. Then, and that brings our nervous system into a state of balance and equilibrium that allows us to get more blood flow up to the top part of our brain so we can think more rationally about what's going on.
That's so interesting because I have been taught some breathing techniques, and that does work, but I wasn't sure why. But like breathing in
Yeah,
5 seconds, hold 5 seconds, breathe out 5 seconds, hold 5 seconds. That's what my doctor told me to do whenever I get super anxious.
yeah, that's box breathing. You just make a box
Hmm.
in your mind. You can do 4 seconds, 5 seconds. You can do beyond that if you want. And people who get really good at this and get a really good vagal tone, they can get to the point where they're only breathing in and out 3 to 5 times per minute. Now that's focused breathing, but they can get to that point. So uh, yeah, that's a
Interesting.
little piece of we can talk about that more later if we want to.
So, how is trauma treated? And when,
So
how does it, does it always need professional help?
So not all trauma needs professional help. A person may find themselves in a very supportive relationship where the other brain is healthy and they're connecting and they're getting better. But this is how you know you need help. If if the original event keeps showing up. So, for
Mhm.
example, I keep turning all of my partners into my first husband, or I just the only way I can have sex is if I get drunk, or if I'm at a hotel. That's the original trauma keeping showing up. If I if if other people uh, are finding me very hard to deal with, live with, that's probably a sense that the trauma keeps showing up in unhealthy ways, and I need to go and look for someone who can treat that. Psychotherapeutically, there there are different therapeutic techniques. I use a very strong interpersonal neurobiological approach where I try and get cued into the patient's nervous system and help them learn to feel safe so that their brain then can register that they are safe. I do a lot of what we call EMDR or bilateral simulation. And that's a technique that puts your brain in a REM sleep state. And when your brain is in REM sleep, that's rapid eye movement, when you're dreaming, your eyes are going back and forth in your head. And as they go to the left side, the right brain is stimulated, and the right side, the left brain is stimulated. So it's like this on and off approach in both hemispheres of your brain. That part of sleep tends to be the part of sleep that releases the psychological toxins of the day. So let's say in the olden days we wrote checks. You bounce a check, you're frustrated, you go to bed, you sleep on it. Next morning you wake up, the uh, bounce check is still there, but it looks a little bit better because you've slept on it and your brain has processed it. So this is a technique that allows us in an awake and conscious state to focus specifically on these traumatic events and induce that same state in your brain to start to release the intensity of it. And so your brain still remembers, but it's looked at now as a memory, and you're not experiencing within the nervous system or the body the way you were previously.
So that REM
And
sleep really helps your nervous system.
oh yeah, if you have it, well, we've got to sleep. We've got to sleep, and we've got to dream. If we're not dreaming, we're not going to heal. Our body's not going to heal. Mind's not going to heal, and we don't have to necessarily remember our dreams. We just have to engage in it. But and one of the problems with victims of trauma is what can they not do? They don't sleep. So they either have to sleep by medicating with meds or alcohol or drugs or sex or whatnot. And but they've got to learn to get that nervous system calmed down, get a good 7, 8 hours of sleep a night, and and generally we'll have about 4 periods of REM sleep every 2 hours if we're getting 8 hours of sleep, and that REM sleep will help us heal. And the body can do some amazing things on its own if we just put it in an environment to do so.
Yeah, you're making me. I'm applying everything to myself because I hate to sleep, and I try to avoid sleep at all costs. I wait for Ralph to go to sleep so I can run back out to my craft room, or it just feels like it's just sleep almost feels insecure to me. But I don't know. That's a whole nother day. But I'm just saying it's funny that you say sleep because sleep is the hardest thing for me in my life. But anyways, so summing up tonight, Matt, I want to make sure that we just kind of sum up what we talked about was that trauma is exists and that we don't need to be dismissive towards ourselves. Our bodies can betray us, which is that thing we talked about when children are molested.
Mhm.
Talked about the different types of trauma and how we can treat it. And then you also talked about connection and attachment and how to show up for people.
Yeah.
Is there anything I missed?
And I think maybe just to piggyback on that, we can't underestimate the power of showing up for somebody. That is that is huge. Um, that's really what a funeral is. We show up for those people who are alive, or celebration of life ceremony, or well, whatever. But showing up for somebody is how we stay connected, and how our nervous systems recognize that we're important, and that heals us. And I I could talk all night, but there's one more bit of research, and this is the last one. I promise I'll share with you. When we have a kind act uh, acted towards us, so someone brings me a soda, or a loaf of bread or something, a piece of pie, whatever. That feels good, not just because I get to eat the piece of pie, but I have serotonin, which is a mood regulator in my brain that's released, and it feels good. The research shows if I just witness somebody across the street bring that same piece of pie to the neighbor and see them do a kind act, I also get serotonin in my brain. So
Really?
we are creatures that want to connect, and the best medicine is kindness between people. Kindness, love, whatever you want to call it, that connection that will help to heal people.
I can relate to the showing up because, um, well, Tracy Peterson Thompson, her name's Thompson now, but she just flew in, 2 weeks ago, and I got her flight information. I went to pick her up at the airport. My husband's driving up me up there, and he's like, why is Tracy flying in?" I'm like, "I actually don't know." So she gets there, and I'm like, "Tracy, are you here to visit Jody? What's going on?" And she's like, "Nope, I just had some time, and I thought I'd come see you." And I was like, there, and I'm just telling you how I can see where that's very healing, because Tracy just shows up. She's always there for the big things and the small things and the and traumas, and for the good. She, she's been there for all the good and bad. When I went to prison, she watched my children, that kind of thing. So I just she's sacred territory for me, you know.
Mm-hmm.
So she just has always shown up for me. And I treasure that. But anyways, I really appreciate you podcasting with me tonight. I can tell we're going to need to do about 10 more of these because we have a lot of subjects we're going to have to cover with you.
That'd be
But
great.
I really appreciate it, and thank you so much for your time. And I hope that our audience, I hope you guys will have learned something, and that you can apply it in your life, and have something positive come out of it. Okay? Thank you so much, Matt. Have a great evening.
Thank you.
I'll
Okay, we'll
talk to
see
you
you.
soon. Okay, bye-bye.
All right, bye-bye.
Hey, Ralph, I don't know how to turn this off.
Good
Ralph?
job, Pam.
Yeah. Well, I mean, I don't know if it's a good job, and I'm not going to listen to it, but I took notes, thank goodness, because I'm like, I'm not going to listen to this again, so I better take notes while he's talking.
So we were probably an hour and 20 minutes.
Well, it felt like, I thought it was going to be like 40. I was like, oh, it's probably about 40 minutes. No, it didn't feel like an hour and 20. I'm going to say that. And you know that thing you said about gaining a sense of
Oh,
resilience? I love what you said about gaining a
yep.
sense of resilience,
Uh-huh.
because I feel like, I don't know, sometimes I say to myself, I've been to prison. What am I scared of? Or what are they gonna do to me? What are they gonna do to me? You know what I mean? Like, I've had this happen, this happen, this happen. I'm not that scared. So I don't know if that's resilience, but sometimes I've used things that have happened to me in the past, but it's just like, bring it on, because kind of like the guy on Forrest Gump who's up there in the, Lieutenant Dan's up there, and he goes, "You call this a storm? Bring it on." I can handle this.
Yeah, and what we have to realize is that, if we've been through something traumatic and then we're having some PTSD symptoms, we have to realize we've already survived the hardest part of this. I mean,
Yes.
we survived the event. You know who Elizabeth Smart is?
Yes.
So about 3 years ago, I invited her to be part of a conference that I was organizing. I was the president of a nonprofit organization, and so she agreed to come and talk. And it's the talk's out there somewhere. But that girl, um, she said she was uh, abducted at 14,
Right.
and she said from when she was taken out of her home that she was raped the first time by that individual about 25 minutes after she was taken out of there. And after that, every day for the 11 months that she was gone, she was raped at least once, sometimes multiple times. And it included pornography. And she said that, uh, obviously she was in a bad state during that 8 or 9 months. But she got into, and I can talk about this publicly because she wasn't a patient. It was a public address. Um, she said, I learned how to um, appease him.
Hmm.
And that first night, um, she went through a sealing ceremony to him. So he sealed her to him as his wife. And uh, she said, I just had to learn that my best chance of survival is doing this. Now, fast forward, 20 years, she's married. She has, I think, 3 children. And she says she gets asked all the time, well, how do you have sex with your husband? And she said, I can make a conscious choice to recognize that all that before was ugly, evil, painful. I had no choice. That this is with a man who loves me, cares about me, is committed to me. And she says it's completely different. And I have to just, she said, I just have to keep that conscious in my mind so that I can um, be here and not live in the past.
You know what she
And
said in her book? Um, I went on a cruise with Tracy and Kelly and my daughters. This was many years ago, and during this cruise, I'm not gonna read a book, but they were reading. All of them were reading this Elizabeth Smart book, and I wasn't because I would just sit there at the buffet and let them tell me all about it. But they said that one of the things they learned was is that the mom, the first night she came home to she took 2 baths, one bath, and then she had to take another bath because she was that dirty. She was just so dirty. And then her mom, when she came out of the bathroom, her mom told her, Elizabeth, they have already stolen this many months of your life. It's up to you if you want to give them one more minute. And so she didn't ask her any questions. Her mom said that she fought every urge to ask for every little detail and just
yeah,
said whatever you want to say, talk about it. But if you don't want to give them any more minutes, you don't have to if you don't want to, which I thought was interesting. It's just an interesting way to look at it.
yeah, and that's what she has said, and she's a real she's amazing.
I'm
She's
just so
amazing
happy
how
you got her. I love everything. I follow her on social media because she talks about, you know, she talks about what children should not only be exposed to and things, but she also talks about that they should be able to have control over saying no of their bodies, that kind of thing.
yeah.
She's real sensitive to that. But anyways, thank you so much. Tell my sister, is she anywhere nearby?
Ellie, she's sitting outside the door.
Oh, is she?
So
Well, tell her I love her and that I'm just grateful that she let me have you tonight. And we need to get together again because there's a lot to cover. I mean, I can tell that there's a lot for my people to learn.
yeah, a couple months. Let's do it. That'd be great.
Okay, sounds wonderful. Thank you so much, Matt.
Thanks, ma'am. Take
Have a
care.
good day. Okay, bye.
Bye.